how many times are you supposed to eat if you are suffering from diabetes? This is the most common question. So most of the times even the dietitians as well as the doctors keep advising the patient, diabetic patient, to eat more frequently. So commonly given advice is you're supposed to eat around 5 to 6 times a day. Instead of eating a single meal, you divide it into two. So breakfast, for example, breakfast you are eating 4 idli, then you are supposed to divide it into 2 idlis. So 2 times, that is 2 idli each time. And the lunch also is supposed to divide into two, and the dinner also is supposed to divide into two. This is what the commonest advice is being given by the doctors as well as the nutritionist. Some of the doctors even they advise to have more frequent food, that is once in 2 hours. You are supposed to consume some food once in 2 hours. This is the advice being commonly given by most of the doctors. Let us see how right is this. So first thing is, so whatever the food we consume, that food will be having invariably it will be having the carbohydrate, and this carbohydrate after entering our body, so it gets broken into glucose, and this glucose molecule gets absorbed into our circulation. We consume food, then invariably the glucose enters into our circulation. So once the glucose enters into our circulation, which is the need of every cell of our body, so the cells can't use this glucose directly, they depend upon the insulin. The presence of insulin in the blood, it tells these cells to utilize this glucose. That means to say, just mere presence of this glucose in the blood, the cells will not be able to utilize it. The insulin has to get secreted, and it has to tell the cells to make use of this glucose. We are consuming more frequently, any food more frequently. For example, if you are eating food about 5 to 6 times a day, then every time the insulin gets secreted, and the insulin will be telling the cells to make use of this glucose. So repeated telling, this results in a resistance. Sensitivity decreases and the resistance increases. That means to say, the cells get resistant to this insulin. That is what we call as diabetes. For example, to make it clear, I will give you one example. If anybody is consuming alcohol, if he is consuming alcohol very occasionally, very rarely, for example, once in 15 days or once in a month or once in 2 or 3 months, then even a small quantity of alcohol, for example, even just 30 ml of alcohol will produce the effect in that person. But if the same person, if he keeps consuming the alcohol, so more frequently, every day, if he keeps on consuming the alcohol every day, then the alcohol resistance develops, and he has to increase the quantity of alcohol that he consumes. The 30 ml will not produce any effect. Then he has to go for 60 ml, 90 ml, 180 ml, or even sometimes even the full bottle he may need to get the same effect. Like that, if anybody keeps on eating more frequently, then the cells get irritated with the insulin, resulting in the insulin resistance. Once there is an insulin resistance, the blood glucose level keeps on increasing, rising. So this is the main reason for diabetes. When we say diabetes, there are two types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes, which contributes for about 2 to 3%, is because of the insulin deficiency, it's a lack of insulin. But the type 2 diabetes is mainly because of, that is about 97% of the diabetes what we see, that is type 2 diabetes, is mainly because of the insulin resistance. So more frequent eating, 5 to 6 times eating a day, is the major cause for this diabetes, type 2 diabetes. If you don't have diabetes and you keep on eating the food more frequently, 5 to 6 times a day, then the risk of developing diabetes will be around 90%. So almost all of us will be eating more than 2 times a day, maybe 3 times or 4 times or even 5-6 times a day. So most of us are in the risk of developing the diabetes. And if you already have diabetes and you are consuming the food more frequently, then the glucose level keeps on increasing, keeps on rising. Then the doctor will keep on increasing the medicine dosage. Later you end up in taking a insulin. Consuming food 5 to 6 times a day in a diabetic patient, it helps to nurture the diabetes. It doesn't helps to cure the diabetes, but it helps to nurture the diabetes, and it helps you to keep your diabetes in control, but lifetime you will be a diabetic patient. Again, this helps more frequent eating in a diabetic patient, it definitely it helps the doctors. So because you will be a diabetic patient for lifetime, so it helps the your doctor, it helps a lab, as well as it helps the medicine companies. So my advice is, don't eat more frequently, whether you have diabetes or you don't have diabetes. Because if you are not diabetic, more frequent eating will give you diabetes. And if you have diabetes, then it keeps on increasing your diabetes. So don't eat more food more frequently. So not more than 2 times a day. It's not 2 meals. Nothing, no nutrient should be consumed more than 2 times a day. Many patients will have this question that, sir, I am a diabetic patient, I am on medications, and if I don't eat in between, then my sugar level will go low. So this is the question the patient will be having. But actually, this is good. You are a diabetic, your sugar level is going low. That means to say you're not supposed to raise your, not supposed to eat more frequently, but instead of that, you can reduce your medications. If it is going, your sugar level is going low, means you're supposed to reduce your medication instead of eating some more frequently. If you want precise and scientific information about health, then only subscribe to our channel. Namaste.